Revolutionary Discovery in the Prevention and Treatment of Sickle Cell Anemia Crisis. By Sota Omoigui, MD, Hawthorne, California, author, The Inflammation Theory of Pain. On July 4, 2024, Dr. Sota Omoigui, a recipient of the U.S. FDA Advisory Committee Service Award for service to the people of the United States of America, discovered and unveiled the first new intervention in 100 years of modern medicine and 1,000 years of human history that is 90% effective in preventing and aborting a sickle cell crisis within the golden half hour. The sickle cell mutation can be traced back to at least 7,300 years. The first recorded cases of sickle cell disease were in Egypt during the pre-dynastic period, about 3,200 BC. In the Persian Gulf during the Hellenistic period, 2,130 years before present, and in Ghana in 1670 AD. For thousands of years, sickle cell disease has been an inevitable sentence of recurrent excruciating pain crisis, resulting in complications, severe disabilities, and death. But Dr. Sota Omoigui's discovery has come to offer a solution to a problem. That is 7,300 years old. As Hippocrates stated in 400 BC, "Let food be your medicine," Sota Omoigui MD declares in 2024 AD that the guiding principles in the management of sickle cell disease shall be: let oxygen be your medicine, whether provided by inhalation or at the molecular level. Dr. Sota Omoigui's discovery, the science and the solution. History. Sickle cell disease was first described by Herrick in 1910. 1927, Hahn and Gillespie suggested that hypoxia or low oxygen caused the sickling of the red blood cell. 1930, Scriver and Waugh in Canada reported that the number of sickle cells in the blood may be varied by the change of the partial oxygen, O2 pressure. That this is a reversible reaction. Red blood cells need to squeeze through pores that are only 4 microns wide. When oxygen is removed, some of the cells sickle and get stuck. Once oxygen is reintroduced, the unsickle process occurs, and the cells now flow normally through the pores. Reversible and irreversible sickle cells. Reversible sickle cells, RSC, can become irreversible sickle cells, ISC, after repeated episodes of sickling with damage to the cell membrane. The reversible sickle cells can revert to their original flexible discoid shape when reoxygenated, but repeated sickling can damage the cell membrane and make it impossible for the cells to return to their normal shape, becoming irreversible sickle cells. Oxygen therapy in the golden half-hour onset of a crisis restores reversible sickle cells and prevents them from progressing to a critical mass of irreversible sickle cells, wherein the sickle cell crisis becomes established and intractable. Developing a medication to prevent and stop a sickle cell crisis within the golden half-hour has defeated the best medical scientists, the best and most resourced pharmaceutical companies, and the best researchers worldwide. The efficacy among Dr. Sota Omoigui's patients has been 90% for prevention and aborting a crisis in the golden half hour. And when you stop the crisis, you prevent the severe pain, emergency care, hospitalization, and multi-organ damage. Should you miss the opportunity to abort the crisis in the golden half hour, subsequent administration of oxygen in a hospital has no effect on the irreversible sickle cells. It just prevents any reversible sickle cells from progressing to irreversible cells. So it only helps to a limited extent in an established crisis. The irreversible sickle cells have to be removed by the body through the process of hemolysis, phagocytosis, or sequestration. It is also necessary to address other factors that may have initiated or are now aggravating the crisis, most common of which is infection, including malaria, pneumonia, etc. References for more information, consultation, or to arrange presentations, contact Dr. Sota Omoigui by email at medicinechief@aol.com.